Knee pain. It's a widespread issue, affecting millions worldwide and impacting everything from climbing stairs to simply taking a leisurely walk. The nagging ache, the sharp stab, the constant throbbing. It can significantly diminish your quality of life, limiting your activities and affecting your mood. If you're one of the many searching for relief, you're likely exploring various options, from medications to injections. But what if I told you that a simple, accessible, and often overlooked solution lies within your own body's natural capacity for healing? Targeted stretching, when performed correctly and consistently, can be a powerful tool in alleviating knee pain and restoring mobility. In the following minutes, we'll explore a selection of the best stretches designed to ease discomfort, improve flexibility, and get you back to doing the things you love. Get ready to discover a path to a more comfortable and active life, starting with a few simple movements. Before we dive into the stretches themselves, let's briefly touch on what might be causing that ache in your knee. Knee pain can stem from a variety of sources. Arthritis, both osteoarthritis and rheumatoid arthritis, is a common culprit, causing inflammation and cartilage breakdown. Injuries such as ligament sprains or meniscus tears are also frequent causes. Overuse, particularly in athletes or individuals with physically demanding jobs, can lead to conditions like tendinitis. It's important to remember that this information is for general knowledge only. Self-diagnosing knee pain can be risky. If you're experiencing persistent or severe knee pain, it's crucial to consult a doctor or qualified healthcare professional for an accurate diagnosis. They can identify the specific cause of your pain and recommend the most appropriate treatment plan. Stretching may be beneficial, but it's essential to know why your knee hurts before embarking on any exercise program. So, why stretching? What makes it such a potentially valuable tool in managing knee pain? The answer lies in the way stretching affects the tissues surrounding the knee joint. Regular stretching improves flexibility, allowing for a greater range of motion. This is especially important if stiffness is contributing to your pain. Furthermore, stretching helps to reduce stiffness in the muscles and tendons around the knee. Tight muscles can pull on the joint, exacerbating pain. By lengthening and loosening these tissues, you can alleviate some of that pressure. Perhaps most importantly, stretching increases blood flow to the knee joint. This enhanced circulation delivers essential nutrients and oxygen, promoting healing and reducing inflammation. Increased blood flow also helps to flush out waste products that can contribute to pain and stiffness. Before you jump into any of the stretches we're about to discuss, there's one absolutely crucial step you shouldn't skip: warming up. Think of your muscles like rubber bands. If you try to stretch a cold rubber band too far, it's likely to snap. The same principle applies to your muscles. A gentle warm-up prepares your muscles for stretching, making them more pliable and less prone to injury. This doesn't need to be anything strenuous. A few minutes of light cardio, such as walking at a comfortable pace or cycling on a stationary bike, is usually sufficient. The goal is to increase blood flow to your muscles and raise your body temperature slightly. This will significantly reduce your risk of pulling a muscle or exacerbating your knee pain. Consider it an investment in a safer and more effective stretching session. Alright, with our muscles warmed up, let's get started with the stretches. First up is the hamstring stretch. Tight hamstrings can contribute significantly to knee pain by pulling on the back of the knee joint. There are a couple of ways to perform this stretch. For the standing version, place one leg slightly in front of the other, keeping both legs straight. Gently lean forward from your hips, keeping your back straight. You should feel the stretch in the back of your thigh. Avoid rounding your back, as this can put unnecessary strain on your spine. If you find the standing version difficult, try the lying hamstring stretch. Lie on your back with one knee bent and foot flat on the floor. Lift the other leg towards the ceiling, keeping it as straight as possible. You can use a towel or strap looped around your foot to help pull the leg closer. Hold each stretch for 20 to 30 seconds and repeat 2 to 3 times on each leg. Next, let's move on to the quadriceps stretch. The quadriceps muscles, located on the front of your thigh, play a crucial role in knee stability. Tight quads can also contribute to knee pain. To perform the standing quadriceps stretch, stand tall and hold onto a chair or wall for balance if needed. Bend one knee and reach back to grab your foot with the same side hand. Gently pull your heel towards your buttock, feeling the stretch in the front of your thigh. Keep your knees close together and avoid arching your back. If you can't reach your foot, you can use a towel or strap to help pull it closer. Hold the stretch for 20 to 30 seconds and repeat 2 to 3 times on each leg. Remember to focus on maintaining good balance and proper form to avoid any unnecessary strain on your knee. If you feel any sharp pain, stop immediately. Don't forget about your calf muscles. These muscles in the lower leg also play a role in knee function and can contribute to pain if they're tight. There are two main calf muscles, the gastrocnemius and the soleus. The gastrocnemius is the larger calf muscle and crosses the knee joint, while the soleus lies underneath and only crosses the ankle. To stretch the gastrocnemius, stand facing a wall. Place one foot slightly behind the other, keeping both legs straight. Lean forward, placing your hands on the wall for support. You should feel the stretch in the upper part of your calf. To stretch the soleus, perform the same leaning stretch, but this time, bend your back knee slightly. This targets the soleus muscle lower down in the calf. Hold each stretch for 20 to 30 seconds and repeat 2 to 3 times on each leg. Now, let's address the hip flexors. Tight hip flexors can pull on the pelvis, affecting posture and contributing to knee pain. The kneeling hip flexor stretch is an effective way to loosen these muscles. Start by kneeling on a soft surface like a mat or cushion. Place one foot forward, so your front knee is bent at a 90-degree angle and aligned directly over your ankle. Keep your back straight and your core engaged. Gently push your hips forward, feeling the stretch in the front of your hip on the kneeling leg. Avoid arching your back or leaning too far forward. It's important to maintain proper alignment during the stretch. Your front knee should not extend past your toes. You should feel the stretch in the front of your hip and thigh, not in your knee. Hold the stretch for 20 to 30 seconds and repeat 2 to 3 times on each leg. Finally, let's target the IT band. The iliotibial, IT, band is a thick band of connective tissue that runs along the outside of your thigh from your hip to your knee. Tightness in the IT band can cause friction and pain around the knee joint. The standing crossover IT band stretch is a simple way to address this tightness. Stand with your feet, shoulder width apart. Cross one leg in front of the other. Lean to the side, away from the leg that is crossed in front. You should feel a stretch along the outside of your thigh on the side of the leg that is behind. Hold the stretch for 20 to 30 seconds and repeat 2 to 3 times on each leg. Remember to keep your back straight and avoid twisting your torso. The focus should be on feeling the stretch along the outside of your thigh, not in your lower back. If you don't feel the stretch, try crossing your leg further or leaning more to the side. Beyond static stretches, gentle knee flexion and extension exercises can be incredibly beneficial for improving range of motion and reducing stiffness. These are simple movements that help lubricate the knee joint and promote circulation. You can perform these exercises while sitting in a chair. Simply extend one leg straight out in front of you, then slowly bend your knee, bringing your heel back towards your buttock. Repeat this motion gently, focusing on controlled movement rather than speed. Another option is to lie on your back with your knees bent and feet flat on the floor. Slowly slide one heel towards your buttock, bending your knee as far as is comfortable. Then, slowly slide your heel back to the starting position. Perform 10 to 15 repetitions of each exercise on each leg. It's crucial to listen to your body and stop if you feel any pain. The goal is to gently encourage movement and reduce stiffness, not to push yourself beyond your limits. Let's take a moment to emphasize something we've touched on throughout: the paramount importance of proper form. Stretching with incorrect posture or alignment can not only render the stretches ineffective but can also exacerbate your knee pain or even cause further injury. Think of it like building a house. A strong foundation is essential for stability. Similarly, proper form is the foundation of safe and effective stretching. Pay close attention to the instructions provided for each stretch, and if possible, consider working with a physical therapist or qualified instructor to ensure you're performing them correctly. This might mean using a mirror to check your alignment, asking a friend or family member to observe your form, or filming yourself performing the stretches and reviewing the footage. Taking the time to learn and maintain proper form is an investment in your long-term knee health. Perhaps the most important piece of advice I can give you is to listen to your body. Stretching should never be painful. It's normal to feel a mild pulling or stretching sensation, but if you experience sharp, stabbing, or intense pain, stop immediately. Pain is your body's way of telling you something is wrong. Ignoring pain can lead to further injury and setbacks in your recovery. Only stretch to the point of mild discomfort. Think of it as a gentle nudge, not a forceful shove. Everyone's body is different, and your flexibility level will vary from day to day. Be patient with yourself and respect your body's limits. Don't compare yourself to others. Focus on what feels right for you. If you're unsure whether a stretch is appropriate, err on the side of caution and skip it. Truly experience the benefits of stretching for knee pain relief. Consistency is key. Sporadic stretching sessions won't yield lasting results. Think of it like taking medication. You need to take it regularly to see an improvement. Aim to incorporate these stretches into your routines several times a week. A realistic frequency might be 3 to 5 times per week. You can even break up your stretching routine into shorter sessions throughout the day. For example, you could do a few stretches in the morning and a few more in the evening. Find a time that works best for you and stick to it as much as possible. Make stretching a habit, just like brushing your teeth. Over time, you'll notice improvements in your flexibility, range of motion, and overall knee comfort. Remember, even small, consistent efforts can make a big difference. While stretching is a valuable tool, it's often most effective when combined with other strategies for managing knee pain. Weight management can significantly reduce stress on your knees, especially if you are overweight or obese. Even a modest weight loss can make a noticeable difference. Supportive footwear can also play a crucial role. Shoes with good arch support and cushioning can help absorb impact and reduce strain on your knee joints. Over-the-counter pain relievers, such as ibuprofen or naproxen, can provide temporary relief from pain and inflammation. However, it's important to use these medications as directed and to consult with a doctor if you need them for an extended period. Remember, these are just a few additional tips. It's essential to consult with a doctor or physical therapist for a comprehensive treatment plan tailored to your specific needs and condition. It's crucial to know when self-care measures like stretching are not enough and when it's time to seek professional help. If you experience any of the following signs or symptoms, it's important to consult a doctor or physical therapist. Severe pain that doesn't improve with rest or over-the-counter pain relievers, significant swelling around the knee joint, instability, or a feeling that your knee is giving way. An inability to fully straighten or bend your knee. A noticeable deformity of the knee joint, pain that is accompanied by fever or other signs of illness. Knee pain that persists for more than a few weeks despite trying self-care measures. These symptoms could indicate a more serious underlying condition that requires medical intervention. A doctor can properly diagnose the cause of your knee pain and recommend the most appropriate treatment plan, which may include medication, physical therapy, or, in some cases, surgery. In addition to conventional treatments, some individuals find relief from knee pain through alternative therapies. Acupuncture, for example, involves inserting thin needles into specific points on the body to stimulate healing. Some studies suggest it may help reduce pain, but more research is needed. Massage therapy can also be beneficial by loosening tight muscles and improving circulation around the knee joint. This can help reduce pain and stiffness. Other alternative therapies that some people explore include chiropractic care, yoga, and herbal remedies. However, it's important to approach these therapies with caution and to discuss them with your doctor before trying them, as their effectiveness is not always scientifically proven and they may not be appropriate for everyone. It is important to note that the efficacy of any alternative treatment may vary from person to person. It's important to recognize that the best stretches for knee pain relief may vary depending on the underlying cause of your discomfort. For example, someone with osteoarthritis might benefit from gentle range of motion exercises and stretches to maintain flexibility, while someone recovering from a ligament injury may need to focus on specific stretches to restore stability and avoid overstressing the injured ligament. If you have arthritis, avoid stretches that put excessive pressure on the knee joint. If you're recovering from an injury, follow your doctor's or physical therapist's instructions carefully and avoid any stretches that cause pain. You may need to modify the intensity or range of motion of certain stretches to accommodate your specific condition. Again, this highlights the importance of consulting with a healthcare professional to determine the most appropriate stretching program for your individual needs. A cookie-cutter approach to stretching isn't always the best solution. While our primary focus has been on stretching, it's important to acknowledge the crucial role of strengthening exercises in long-term knee health and pain management. Strong muscles around the knee joint provide support and stability, reducing stress and preventing further injury. Exercises that strengthen the quadriceps, hamstrings, and calf muscles can all contribute to improved knee function. Examples include squats, lunges, and calf raises. However, it's important to perform these exercises correctly to avoid putting undue stress on your knees. Ideally, a comprehensive knee pain management program should include both stretching and strengthening exercises. However, since the purpose of this discussion is to target stretching, strengthening exercises will not be covered in detail here. Consult a physical therapist or qualified fitness professional to develop a safe and effective strengthening program for your specific needs. To help you get started, here's a sample stretching routine incorporating the stretches we've discussed. Remember to warm up for a few minutes beforehand. Point 1. Hamstring stretch. Standing or lying. 2 to 3 repetitions, holding each stretch for 20 to 30 seconds per leg. Point 2. Quadriceps stretch. Standing. 2 to 3 repetitions, holding each stretch for 20 to 30 seconds per leg. Point 3. Calf stretch. Gastrocnemius and soleus. 2 to 3 repetitions, holding each stretch for 20 to 30 seconds per leg. Point 4. Hip flexor stretch. Kneeling. 2 to 3 repetitions, holding each stretch for 20 to 30 seconds per leg. Point 5. IT band stretch. Standing crossover. 2 to 3 repetitions, holding each stretch for 20 to 30 seconds per leg. Point 6. Gentle knee flexion and extension. 10 to 15 repetitions per leg. This routine can be performed 3 to 5 times per week. Adjust the number of repetitions and hold times based on your individual needs and comfort level. Always listen to your body and stop if you feel any sharp pain. Remember, this is just a suggestion and individual programs will likely vary. In conclusion, stretching offers a multitude of benefits for knee pain relief, including improved flexibility, reduced stiffness, and increased blood flow to the joint. By incorporating the stretches we've discussed into your routine, you can take proactive steps towards managing your pain and improving your overall quality of life. Remember that consistency, proper form, and listening to your body are key to success. Start slowly, gradually increase the intensity and duration of your stretches, and always stop if you feel any sharp pain. While stretching can be a valuable tool, it's not a substitute for professional medical advice. It's essential to consult with a doctor or physical therapist to determine the underlying cause of your knee pain and develop a comprehensive treatment plan tailored to your specific needs. Taking control of your knee pain starts with knowledge and action, so take those steps today.